Hello everyone, we are from Group 6 and today we are going to talk about neoplasm. What is neoplasm? A neoplasm is an abnormal mass of tissue, the growth of which exceeds and is uncoordinated with that of normal tissue and persists in the same excessive manner after cessation of the stimuli which evoke the change. What triggers this neoplasm? There are several causes which trigger the neoplasm, such as through nutritional, like low fiber diet, high animal fat diet and less antioxidant vitamin, radiation such as UV and X-ray radiation, radioisotopes and nuclear fallout. Besides, neoplasm also occur through genetic, which is inherited. Virus like HIV, HDLV, papillomavirus, herpes simplex virus, Epstein-Barr virus and hepatitis B virus. Next is chemical, which includes tobacco products, asbestos and heavy metal. Last but not least, hormonal causes such as estrogen, oral contraceptive, and steroids. Next, we move on to a quick overview of pathogenesis of malignant neoplasm. Started with a normal cell which is being exposed with acquired DNA damaging agents such as chemical, radiation, and viruses. If the DNA damage is able to be repaired, the cell will return to its pre-injury state. If the DNA damage is failed to repair, it may be caused by inherited mutation in genes affecting DNA repair and genes affecting cell growth and apoptosis, hence leading to mutation in the genome of somatic cells. Mutation in genome of somatic cells lead to three possibilities, which are activation of growth-promoting oncogenes, alteration of genes that regulate apoptosis, which both contribute to unregulated cell proliferation, and inactivation of tumor suppressor genes that will decrease the apoptosis of mutation cells. This lead to the clonal expansion of mutation cell, then progression of tumor will take place. Sufficient tumor progression contributes to presence of malignant neoplasm. Malignant tumor allow the presence of metastasis and invasion to happen. Neoplasm can be classified into two types, which are benign and malignant tumor. Now, let's take a look at the differences. Benign and malignant tumors can be distinguished from one another based on the degree of differentiation, rate of growth, local invasiveness, and distance spread. Benign tumors resemble the tissues of origin and are well differentiated. Malignant tumors are poorly or completely undifferentiated. Benign tumors tend to be slow growing, whereas malignant tumors generally grow faster. Benign tumors are well circumscribed and have a capsule, while malignant tumors are poorly circumscribed and invade the surrounding normal tissues. Benign tumors remain localized to the site of origin, whereas malignant tumors are locally invasive and metastasize to distant sites. A benign tumor is a mass of cells that lacks the ability to either invade neighboring tissues or metastasize. The benign tumors are enclosed by a capsule consisting of connective tissues. It tends to remain localized at the site of origin. Benign tumors generally have a slower growth rate than malignant tumors, and the tumor cells are usually more differentiated. This histology slide shows the lipoma of the stomach. At low power of magnification, the epithelium is seen to be well demarcated and well differentiated. This cell can be grown by expansion and no criteria of malignancy. They are typically surrounded by an outer surface of fibrous sheath of connective tissue or stay contained within the epithelium. It is capsulated and resembles the normal tissue. Fibroadenoma of the breast is a benign tumor in which the entire lobular tissue proliferates. It contains a mixture of epithelial and stromal tissue. The stromal component is usually predominant. The epithelial tissue is composed of ducts lined by double-layer epithelium, and the stromal component is made of fibrous tissue. Thus, there is proliferation of both glandular elements and the normal loose connective tissue stroma of the lobule. Dysplasia is the cell growth involving abnormal morphological changes of cell, which mean changes in phenotype of cell. It is an increasing degree of disordered growth or maturation of the tissue, which may signify a stage preceding the development of cancer. Dysplasia occurs most often in epithelial cell, which is characterized by cellular proliferation and cytologic changes. The histological slide below shows the normal squamous cell and dysplasia cell. On the left side, it is the normal squamous cell with normal size of cell nucleus. On the right side, that's a dysplastic cell with larger cell nucleus due to increase of nuclear cytoplasmic ratio. Besides, the dysplasia cell also have nuclear hyperchromatism, which causes excessive nuclear staining. Basically, the histological features that characterize dysplasia are cytological features, which involve nuclear and cytoplasmic changes, and architectural features involve irregular gland outline and variability in glandular size. Dysplasia is a part of pre-malignant process. The progression of dysplasia starts when abnormal stimulus such as genetic abnormality apply on the cell. The cells go through abnormal changes which increase in the number of cells and proliferation. Then the cells undergo dysplasia. They begin as low-grade dysplasia, which means the cells are not too different from original cells. However, without removal of stimulus, the dysplasia gets worse and change to medium grade, and continue grow to high grade of dysplasia, which the cells are very different from their original phenotype. Finally, it grows into carcinoma in situ. They have not yet penetrated the basement membrane. Most carcinoma in situ will continue growing and penetrate the basement membrane, and they begin invading other regions. Once they pass the basement membrane, they are referred to as invasive carcinoma or cancer. These are the histological slide of progression of dysplasia from mild to carcinoma in situ. Number 1 shows the normal stratified squamous epithelium. Number 2 is the low-grade dysplasia that shows nuclear angulation and vacuolization. It also shows the minimal nuclear abnormalities and few mitotic figures. Number 3 shows the medium-grade dysplasia in which the dysplastic cellular changes occur at the lower half or 2/3 of the epithelium. The mitotic figures may be seen throughout the lower half of the epithelium. Number 4 shows the high-grade dysplasia or carcinoma in situ that shows nuclear abnormalities extending throughout the thickness of the epithelium. Many mitotic figures have abnormal forms. Let us look more details on the histological changes of carcinoma in situ. Cervical intraepithelial carcinoma in situ will be our example. During carcinoma in situ stage of dysplasia, we will notice that the dysplasia cells with nuclear enlargement and elevated nuclear density proliferation in full thickness of epithelium. Besides, the dysplasia cell didn't invade through the basement membrane. Next is malignant tumor. Malignant tumors are cancerous. They develop when cells grow uncontrollably. If the cells continue to grow and spread, the disease can become life-threatening. Malignant tumors can grow quickly and spread to other parts of the body in a process called metastasis. Here is histological feature of malignant tumor, included first increased nuclear size which high nuclear cytoplasmic ratio, and second mitosis. The stroma cell show marked atypia with numerous mitosis by orange circle, prominent nucleoli shown by the white arrow, and high nuclear to cytoplasmic ratio by the red arrow. High nuclear to cytoplasmic ratio is a strong predictor of malignancy. Next is pleomorphism. Pleomorphism describes variability in the size, shape, and staining of cells and their nuclei. Cells in this slide have different nuclear, cell size, and shape. Another histology feature of malignant tumor is hyperchromatism. Hyperchromatism is the development of excess chromatin or of excessive nuclear staining, especially as a part of a pathological process. This slide shows small round or elongated cell with hyperchromatic nuclei and scanty cytoplasm arranged in sheets, nests, ribbons, and in a peritheliomatous pattern. Last histology feature of malignant tumor is aneuplosia. Aneuplosia is a condition of cells with poor cellular differentiation, losing the morphological characteristic of mature cell and their orientation with respect to each other and to endothelial cells. This cell in the slide show has lost its own characteristic and is poorly differentiated. Malignant tumor that are collectively referred to as cancer can be divided into a few types, including carcinoma, sarcoma, myeloma, leukemia, lymphoma, and mixed tumors.
Malignant neoplasms of epithelial cell origin derived from any of the 3 germ layers are called carcinoma. Thus, cancers arising in the ectodermally derived epidermis, the mesodermally derived renal tubules, and the endodermally derived lining of the gastrointestinal tract are all termed carcinoma. Carcinoma usually affects organ or glands capable of secreting, including breast, lung, skin, colon, and prostate. Next, carcinoma can be further divided into adenocarcinoma and squamous cell carcinoma. Adenocarcinoma denotes a lesion in which the neoplastic epithelial cell grow in a granular pattern, while squamous cell carcinoma denotes a cancer in which the tumor cells resemble stratified squamous epithelium. Next, we are going to look at the histological changes between the normal cell skin and squamous cell carcinoma of the skin. The left side indicates the normal one. The arrow shows the epidermis is a keratinized stratified squamous epithelium, which, in thick skin, has a very thick keratinized layer known as the stratum corneum. The right slide shows how the squamous cell carcinoma develops. We can see the arrow shows the squamous epithelial cells are arising from epidermis and extending into the dermis. The circle shows the variable keratinization. at the higher magnification, the circle shows more clear keratin pearls. The upper arrow shows one of the examples of pleomorphism, and the lower arrow points at the elongated dark blob, shows the mitotic activity. Lastly, we are going to look at the histological changes between the normal cell of a prostate and prostate adenocarcinoma. So, the left side shows the prostate gland with acinous and acinous cells. Basal cells are between secretory cells and basement membrane, and are believed to be the stem cell compartment of acinus. But in the adenocarcinoma cases, we can see loss of basal cells, small crowded glands lined by a single layer of cells, nuclear enlargement, hyperchromasia, pointed by the yellow arrow, and a prominent nucleoli. The red arrow shows the lumen containing bluish mucin. Multiple myeloma is a plasma cell malignancy in which the monoclonal plasma cells proliferates in bone marrow, resulting in overabundance of monoclonal paraprotein that can lead to destruction of bone and displacement of other hematopoietic cell lines. The slide shows the normal bone marrow cells and multiple myeloma. In the left slide, major normal bone marrow cells are shown in the center of intertrabecular space. The squiggly arrow shows a band neutrophil, and arrow with tail shows the segmented neutrophils. Bizarre cells, which are multinucleated, are pointed by the center yellow arrow in multiple myeloma in the right slide. Flame cells, which are pointed by the right yellow arrow, can be seen here. It has a fiery red cytoplasm, which are not usual in a normal plasma cells. Next, we are going to see the malignant tumor arising from the blood-forming cells and affecting bone marrow are designated leukemia. Bone marrow begins to produce excessive immature white blood cells that fail to perform their usual action, and the patient is often prone to infection. The slide shows the normal blood cells and peripheral blood smear revealing histopathological features, indicative of a blast crisis in a case of chronic myelogenous leukemia. Blast crisis occurs when 1/5 to 1/3 of the cell in the blood or bone marrow are accumulated. In lymphoma, it can be defined as tumors of lymphocytes or their precursor that affect lymph nodes at specific sites such as brain, stomach, and intestines. The slide shows the normal lymph nodes cells and Hodgkin lymphoma. The neoplastic cells are represented by large transformed monoclonal B cells, which usually single large convoluted nucleus containing one to several small basophilic nucleoli, shown by the arrows. The nucleoli are almost always small in size. Now, we are going to look at the grading of the tumor. Grading is about cellular differentiation and the abnormality of cells. In general, tumors are graded as 1, 2, 3, or 4, depending on the amount of abnormality. The increase of abnormality increases the grade of tumor from 1 to 4. The slide here shows the normal breast cell. The breast is composed of ducts and acini arranged in lobules, embedded in a fibrous stroma and with abundant associated adipose tissue. The fibrous tissue immediately around the ducts and acini is a little more delicate. Vessels and nerves are scattered throughout and are usually not very obvious. There are few leukocytes scattered around the duct, and the lumen contains some relatively dense secretions. What can be seen from this slide is the cells are well differentiated and still close to normal cell, but there is still little variation in size and shapes. The tubules are still clearly seen. The cells also still has a good border. The nucleus have dispersed chromatin and with no prominent nucleoli. The mitotic figures cannot be seen in this slide, thus this is a grade 1 of a breast cancer. Next, we can see this is a grade 2 tumor. What we can observe is the cell is moderately differentiated, poorly formed gland and have a slightly abnormal. There is a moderate pleomorphism, which means there is a moderate variation of the size and the shape of cells. The nucleus of each cancer cell is small to medium in size, and all the nuclei of the cancer cells have the same shape and condensed chromatin. Besides, in grade 2 tumor, the mitotic figures also can be seen in this slide. As we can see in this slide, which is a grade 3 tumor, the cells are poorly differentiated, grow and spread rapidly, marked with a cellular pleomorphism, which is variation in size and shape of cells and frequent mitosis. It has largely pleomorphic cells, the nucleus has prominent nucleoli, coarse chromatin, and it is excessively stained. We can see that the chromatin is dark in color in this slide. There is a cellular pleomorphism and an abundance of mitotic figures seen in these slides, since they are rapidly dividing cells, and thus tissues composed of cancer cells will have an abnormally high number of cells in mitosis. Thank you for seeing this slide presentation.